What are some derealization triggers? Derealization is a dissociative symptom often linked with post-traumatic stress disorder and depression. It creates a feeling that the external world is unreal or distorted. Understanding what triggers derealization is essential, especially for those experiencing PTSD, where these symptoms can form part of a dissociative response. One common trigger is exposure to reminders of past trauma. This can include situations, places, sounds, or people that evoke memories of traumatic events. For individuals with PTSD, these trauma cues can lead to intense emotional responses or dissociation as a coping mechanism. Another significant trigger is severe emotional stress. Major life challenges, such as relationship issues, financial difficulties, or work-related pressures, can provoke episodes of derealization. When stress levels rise, it can become overwhelming, leading to feelings of detachment from reality. Childhood trauma and adversities also play a role. Early experiences of abuse, neglect, or unstable caregiving can increase the likelihood of dissociative symptoms like derealization later in life, particularly when PTSD develops. Intense fear or a sense of threat can trigger derealization as well. Sudden physical injuries, threats of harm, or experiences of violence can disrupt emotional regulation and lead to dissociation. Emotional overwhelm and suppression are additional triggers. In the dissociative subtype of PTSD, the brain may overregulate emotions, resulting in emotional detachment and feelings of unreality as a defense against overwhelming feelings. Co-occurring mental health conditions, such as serious depression or anxiety, can also increase the risk of derealization. This is particularly true when these conditions are accompanied by panic attacks. Substance use is another factor that can induce or worsen derealization symptoms. Misuse of drugs can lead to altered perceptions and feelings of unreality. Derealization in PTSD is part of a broader dissociative response that may include depersonalization, which is the feeling of being detached from oneself. This subtype is often linked with more severe trauma histories, including childhood adversities and repeated traumatic experiences. Brain imaging studies show that individuals with PTSD and derealization have altered brain circuits related to fear processing and emotion regulation. Unlike typical PTSD, where emotional responses are underregulated, the dissociative subtype involves overregulation, leading to emotional numbness and detachment from reality. Recognizing triggers such as trauma reminders, stress, and emotional overwhelm can help individuals manage derealization episodes. Treatment approaches may need to be tailored to address the dissociative subtype specifically, focusing on grounding techniques, trauma-focused therapy, and strategies to improve emotion regulation. In summary, derealization triggers in PTSD and related conditions include trauma reminders, severe stress, childhood trauma, intense fear, emotional suppression, co-occurring mood disorders, and substance use. These triggers reflected the complex interplay between trauma history, brain function, and emotional regulation in PTSD with dissociative symptoms. Always consult a healthcare professional for personalized advice and support.